Ms. Kela Bega, the Deputy Secretary General for KMPDU, who will be giving us the final or closing remarks. Once we are done with that, you remember the tea? Remember the tea? The tea will be served at the garden, so you have a beautiful spot out there at the garden where you can engage this conversation further, chat a bit, enjoy your tea. But as we all walk out, I will invite the media team to come to the fore. But that is after the closing remarks. So first, let's begin with the Deputy Secretary General, KMPDU.
Good morning. Thank you very much. So as we close, I want us to close on high remarks and on high note. So when I say viva, comrades, viva, you say viva, okay? Viva, comrades, viva. Viva, Wakenya, viva. We must have energy when we are making demands. Sindio? Yes, I'm Dr. Ms. Kela, the Deputy SG, to Dr. Davji from KMPDU. And as I summarize this, I have to first of all apologize that I came late. I was following online. I had a word round, so I was like, do I come to talk about health as a right here, or do I give the Kenyans their right in the word round first, then I come here? I chose the reality bit of it, yeah? Yeah, so first of all, you know, the president of the urban poor was here saying that Mungu atubariki. No, if God blesses us, we can't be in this union or this association because we won't be any poor. Sindio? Yeah, so anyway. So there's a story about the village baker who used to bake very nice bread. But the only problem is that as he went about marketing his bread and talking about this bread, when time came for his breakfast, he would go to the neighboring shop to buy the bread for himself and his family. And that's where we find ourselves as Kenyans. We have a village baker in the politician, in the leaders in healthcare, making beautiful promises, how their bread is the best. They'll make bread for everybody, UHC bread, you know? But when time comes for breakfast for themselves and their families, they buy bread in the next shop. So that when we complain that this bread is too salty, too sugary, they never know what we are going through because they are buying bread from the next shop. And we are telling the Kenyans today that if the baker cannot listen to us telling them what we want in the bread, we want less yeast, it's giving us bloating, right? We want less salt probably, okay? We are telling them that even the bread they're writing as 1 kg is 800 grams. We must tell them and they have to listen. Or we'll have to start baking our own bread. Sindio? Luckily enough, in August we have a chance to be involved in choosing our next set of bakers. I hope that we won't be putting back the same bakers who have given us bread that bloats us. That analogy is as simple as it is. I don't think it requires any interpretation. Sindio? 2, when you hear colleagues, Dr. Gibore, Carol, talking about some of the things that they have undergone or have witnessed as the healthcare fails, those are the few stories of somebody who gets a chance to pick a microphone and talk about it. But it is replaced everywhere in this country. Every village can tell you that they have a death that could have been prevented. True or false? During the COVID times, you have lost almost 6,000 Kenyans, probably more than that. Of course, the numbers will have to be lowered because the shame is too much for the bakers. Yeah? If you look at the deaths, they could have been prevented. I work in Kenyatta as a gynecologist. And the people who we see die, they're mostly referrals. Because for the women, dying from very preventable things that can be picked up early enough. If we could let the community health workers be properly trained, paid, and motivated. Of course, let me digress briefly that, let me digress briefly by saying that when you want to kill a dog, you first give it a bad name. So they have intentionally called them the volunteers for a reason. When the white man came and wanted to colonize us, they told us, we'll have to Christian you, a new name, a Christian name. True or false? That's why we must push back from the name first of all, before we demand for any other right. So, anyway, that's a digression. But we must stop seeing death as what is promised. We live in a country where when somebody dies, even from something that could be prevented, we say God plucked the best from his garden. Sindio? Kwani Mungu ana pluck tu maskini, he does not teach. That we must carry twigs when our people die from preventable causes. When schools fail, we carry twigs and chase the headmaster. When the roads are bad, we carry twigs and plant bananas on the roads. How comes that when our people die, now it is God plucking the best? How comes that we ask that the roads are bad, we'll get better roads paved with gold in heaven? We demand. Let us demand for better healthcare. I want to talk briefly about something that our country lately is crazy about. Privatization of public failures. That is what is killing us. I think that government intentionally has killed the public health system to prop up the private sector. So that when you, and more than ever, if there's a government that puts private interests in healthcare than any other government, is the Uhuru Kenyatta government. Get that? So when they clap to you that, oh, NHIF will be for everybody, 80% of NHIF goes to private hospital. And in private hospital, it's business. I normally use the analogy that it is not out of the goodness of the butcher that he sells meat. Mtu akifungua hospitali pale, ni pesa anataka. That's why if you are having an emergency, they won't take you in. Usipolipa, they'll detain you. Yet with this privatization, there has risen a new level of private sector. Now when the public fails, you go to the private sector, right? Hoping that you get better services. But now we have a new set of poorly run, poor quality private sector. Offering poor healthcare for poor people. Yeah. Right now I have a friend of mine, he's in New York, his wife came over for a funeral, then she got malaria, then she's been going to this funny facilities. She's now in ICU in Kenyatta with cerebral malaria, dying almost. Yeah? Because they went to these funny facilities. So we must shift back the debate on how do the patients leave the public healthcare to the private, and how do we take them back? Because if we don't do that, we are just one major illness away from poverty. Trust me that as a doctor, currently I don't belong to Opioids Association. I'm not an urban poor. But every day as I sleep, my only worry is about my aging parents. We will all die. That's a promise. So I know one day they're going to die. My worry is that what kind of bill will I have to endure in that process to make them live longer, or as they die comfortably? That's what I worry about every day about my aging parents. And I'm sure most of you worry about that. Sindio? And we must take that burden away from the Kenyan people. The living must stop worrying about the death and the dying people. And now we have Ruto promising the universal health coverage. Babake is just about the same thing. All they're telling you that they'll be collecting lots and lots of money to bake bread. But they're not telling you that they're going to be making better bread for you. You get that? So you cannot compel us to pay for the insurance funds. That's how it will help us, how it will translate to quality healthcare. Right from the down, where we have community health is talking about hand washing, talking about anti-helminthic C, kupeana nini, dawa ya minyo. All the way up, you know that if they pick up something, they can take it to level 1 or level 2. You get that? Please, as we go to this election, you either be part of the people on the dinner table eating or part of the menu. Let's engage the politicians. Let's chat them, sign our charter. More importantly, please, let's vie. We have healthcare workers. Let's support them. I know Dr. Luga is vying. I know Seth Panyako is vying. And many others are vying. Let's support them. Kwa hali na mali. Viva Wakenya, viva!